Hi, everyone. This is Professor Papier Bernstein again, talking about the therapy session, part 2. And this is, again, topic 6. You have the information on Blackboard. It corresponds to chapters 6 and 7 in your text, and external links 4, 5, and 9. And this is part of the lecture that corresponds to the therapy session, okay? And I'll be talking about features of a therapy session from good practice, best practice perspective. Most of these come not necessarily from the field of speech-language pathology, but from educational research, and they certainly are applicable to, in that being the case, to our work in the school setting, which of course is what this course is about. So they are also applicable, however, to any type of clinical setting, as you will see. So the first thing that I'd like to mention is something that we call the physical environment. And the physical environment is comprised of many variables, but we're just going to talk about a few of them. Let's start with lighting, heat. These are things that you may be able to control, you may not be able to control. However, light is something that you can certainly supplement, as well as heat. So think about portable lights, think about portable heaters if you need them, because comfort of your clients is of utmost importance. Something else under physical environment, and this is true especially if you're working with small children, relates to furniture, and specifically the match of the size of the furniture, the tables and chairs. I've seen examples, for instance, of children with their legs swinging because they did not have support under their feet. And it just sets your entire body off. You're not able to use both sides of your body appropriately. We're always talking about positioning in a chair when you're not 90, 90, 90. What happens if the back and your butt is not pushed all the way against the back of the chair? We know, we've seen kids slouch. It's difficult to be very physical on with this mode. But there are a lot of examples that I often give of furniture mismatches. It's a good idea to have little pieces of remnant carpet in your room so that you can pull young children onto the floor and work with manipulatives there. But please be aware of the, what I call the elbow syndrome, where kids are trying to prop themselves up by putting their elbows on the table because the chair is just too little for them, or if the chair is too big, they're falling off the chair. So it's very easy to have empty cartons in the room to put underneath their feet, etc. Another aspect of the physical environment has to do with clutter. I've seen clutter tremendously impact the outcome of a therapy session, and until it was brought to the clinician's attention, wasn't even aware that it was interfering. But as soon as they put up very easy to do curtains over open shelves, a very plain kind of fabric that you can get from the fabric remnant store that doesn't cost a lot of money. Organizing things neatly, putting all kinds of open folders in cartons, taking off anything from the shelves that seems to accumulate dust, which can set off allergies, as they say, etc., etc. Okay, I could go on with this, but let's leave and go to tempo and timing at number 2.2. And what we mean by tempo and timing is really the spacing out of everything that happens in the clinical intervention session so that you're not rushing through any aspect of it and you leave time for everything. There are certain aspects of a therapy session. For example, you're probably going to be starting with some kind of readiness activity. It might be a review of prior work, and then you're going to be using certain techniques. You're going to be introducing materials and activities, and leaving time for carryover, leaving time for homework, review at the end. And I've heard therapists say to me, "Oh, I didn't have time for homework. I just didn't have time to finish the game. So we started a game, we didn't finish it." So you really need to get a sense of tempo and timing. The tempo and timing also might relate to the ratio of student to teacher talk time, we call it. And that has to do with the amount of time that you're actually not talking and stopping yourself from talking. So we're renowned in our field, in any kind of teaching field, for saying too much and not providing enough opportunity for our clients to talk. So that means that the balance is off. How do you fix that? How do you work on that? Well, you just have to quiet yourself. Sometimes what we do is we can try to increase our pausing. We can purposely, like that, build in hesitations and pauses. People feel uncomfortable when there's too long of a period without anyone saying anything. But you can use that technique and see what happens. You can increase the ratio of client talk time or student talk time by the way you construct opportunities, and you kind of have to engineer your therapy sessions so that there are more opportunities in there. I'm going to try to put this on pause, but for some reason I'm not able to do it. All right. Let's see if I can turn off. I don't know if I can do that right now. No. I'm hoping that you're not hearing my emails coming through, but I have a feeling you are. At any rate, enjoy the sound fest. Okay, so I think what we're going to do is leave tempo and timing and move to preparation and planning. Okay. What we mean by preparation and planning is the setup. Now, we're never 100% of the time, and there are always going to be times, realistically, in your therapy sessions that you haven't really planned to the extent that you would have liked to. However, you will learn in your quote-unquote bag of tricks that you can always have backup activities, backup materials that seem to work with that particular student. But there is a certain amount of preparation and planning that you need to put into every therapy session. And please know that if you're doing your work completely off the top of your head, so to speak, something is very wrong. We can fudge it sometimes, and we all do. And we will have similarities from case to case during the course of our day. But you need to give thought to the clinical intervention process for every single one of your therapy sessions every day. Questioning is another feature of a therapy session that is something we have a lot of control over. There are different types of questions that we use. that elicit different types of information. When we learn about interrogatives from a developmental perspective, we know that certain questions elicit certain types of information. For example, we know that when questions certainly will elicit information about temporal concepts, it's time related, where is spatially related, who, of course, is noun, person, place, or person related. But we're also not only talking about those kinds of questions, but talking about the use of open-ended kinds of questions, questions that will elicit a more divergent type of response as opposed to convergent responses. We're looking for open-ended. We are even looking to use the kinds of questions where we might place, if we're working with a small group, the student's name before the question to prime that student with the knowledge that they're going to be called upon. Or if we put the name after the question, then everyone has to prepare themselves to answer it. So please know that questioning is a very sophisticated technique. And when we learn about questioning in our language disorder classes and our developmental language classes, that's also information that we can apply to our own therapy sessions. Let's move on to routines and the use of routines. Why are routines so important in our work? Routines are important for many different reasons. First of all, there's a familiarity about routines. People know what to expect. That's why routines are so important in our lives. We know what to expect because we've done the routines again and again. We all have routines that we're familiar with, as do students. We are more comfortable when there's a lack of surprise. Of course, surprise elements keep us on our toes, but routines build comfort. There is a technique, and you can check this out on the web. It's called JARS, or Joint Action Routines. And we used to use this a lot in my district, in the speech therapy programs in District 75, the New York City Department of Education. And there were certain elements. We would do training sessions for the therapists, and there were certain elements of joint action routines that the therapists learned they could apply to all of their therapy sessions. For example, having a very clear-cut beginning, middle, and end. Then the kids know what to expect. They know what's coming next. It creates the comfort and familiarity. One of the other aspects of routines that comes from a JAR, or a joint action routine, is the use of some type of prop. So if there is a certain type of activity that's going to be a part, or a material that's going to be a part of your therapy sessions with particular students or groups of students. For example, it might be a literacy activity that's built in at a certain point, and you might have a prop. So there might be a big book in the room, or it might be a picture symbol of a book, or it might be a pair of glasses that you put on. And when you put that pair of glasses on, your students know that it's reading time, it's book time. And of course, you might need the glasses, so you'd have to put them on. So routines are very useful. One of the best times for early childhood classroom collaborations is during circle time. We love circle time, and one of the reasons we love circle time is because circle time usually has very clear-cut routines going on in the classroom, where the kids know they bring their chairs up, they put them in the circle, they know exactly what's going to happen next, and it just builds comfort. Learning, certain types of learning is more apt to take place when the learners feel safe and feel comfortable. Then again, there are times that it's better for carryover purposes to build in more unknown expectations, but I will talk about that at another time. Let's go on to the next, individualization. And individualization really has to do with the balance between dealing with the individual and dealing with a small group. Special education has been described as a type of service where there's much too much individual attention going on. Individualization is very important when new learning is going to take place, but for purposes of carryover and generalization and transfer of learning, whatever you choose to call it, group interactions serve a much more naturalistic purpose. Let us move on to, I'm not going to go through each one of these now because I'm already talking close to 16 minutes. But the last thing that I would like to talk about is rapport. Rapport, of course, is one of the most important features of a therapy session. There's nothing more important in our work than what happens. And this was described once by someone, a practitioner doing a lecture in one of my meetings. And the term was so wonderfully explained. And she said that it's almost like, when the session seems magical and it's almost like you're in that Zen state, it seems like a sacred space. And that's where the therapy takes place. So I like that. I think it's very, it really is very descriptive of what happens. It's almost a magical feeling between the clinician and the client when you are really connecting, and that rapport. It's no different really than when you're feeling that with another person in any kind of setting, but it does happen. We can facilitate it, and it happens via our relationship with our client. And it's a sense of trust. Again, it's a sense of comfort. It's a sense of feeling safe. So please keep in mind that nothing happens if there is not the establishment of rapport between yourself and your client, and that is true with any type of therapeutic services. And I think with that, I'm going to sign off for this lecture. Thank you.